Welcome back to North State Health, the North State's first local health program.
Welcome back. Our guest today is Dr. Ray Powell from Physicians Plan Weight Management. Today we're talking about facial aesthetics, which goes along hand in hand with, or face to face, as we were saying, with weight loss or weight gain, you know, and some people may be doing these. A lot of people are familiar with the word and the procedure Botox.
Right.
And we are going to talk a little bit about that, or a lot about that actually, in the next segment. But there are some other products that you have at your stores and some treatments. So let's talk about those that maybe people haven't heard of them.
Well, at the offices we have skincare product lines that we use, and the first one we use, which is a really high-end product line, is called Vivite. And Vivite is a product line that's medical grade. It's only sold to physicians under prescription that the people take home with them. But it uses antioxidants as well as glycolics and different chemicals that really help instill moisture back into the skin and help improve the whole tone of the skin. Then we go into another product line which is called SkinMedica. And SkinMedica also has skincare lines. It's actually now been bought out by Allergan, which owns Vivite, so eventually it'll be under the same line. But these are where we use chemical peels. So we're going from surface to a little bit deeper under the skin, where we're using different peels. One is, for example, called Illuminize. And Illuminize is a type of peel that you can have done, and literally that night you can go to a dinner party. It gives you kind of a nice warm glow and helps kind of moisturize the skin. But then we have ones that are much deeper that also use glycolics and retinoics that help really take off that first layer of skin. So there will be a little bit of skin peeling afterwards for a day or two. Then we go into even deeper of a procedure, which is called HydraFacial. And HydraFacial is a machine that we use that actually not only takes the dead skin off and the sebum, but also helps put serums into the skin. So I brought a video that I'm going to show here that shows kind of the science behind the HydraFacial machine.
The HydraFacial uses the unique patented HydroPeel tip to exfoliate dead skin cells and extract impurities, while simultaneously cleansing and hydrating the skin. The serums soften the dead skin cells and sebum, making it very easy to peel off those impurities. The spiral design of the HydroPeel tip gives it multiple abrasive edges, which means that the skin is exfoliated several times each pass when the tip planes over the skin. The spiral design also allows the serums to stay on the skin longer to boost performance and absorption time.
Now, you said that some of these, the products, you know, they can take them home even though they are by prescription. With something like that, is that an inpatient procedure when you use that
the
machine?
HydraFacial is an incredibly comfortable procedure. It's one where it's a lunchtime procedure. They can go right back to work, and it just really gets all of the dirt and the oils out of the pores and also helps instill those serums. But then what they'll do is they'll also take the Vivite product lines home with them to help keep that moisture going, and they can get the HydraFacial procedure done, you know, once a week or once a month, just to kind of keep the maintenance up with it.
I'm talking about, you know, the first two products with the peels or the creams or that type of thing. Are these things that you would use over a long period of time?
Exactly. People will use them periodically because, you know, everybody says, well, how long does it last when you talk about any kind of procedure? It's how long you take care of your skin. I mean, it's making sure you use sunscreen. It's making sure you do good hydration, good nutrition. So even, you know, even a full plastic surgery facelift can only last sometimes 5 years, but it also depends on whether you smoke or whether you're in the sun and baking your skin and not using sunscreen. So it's a constant renewal that you have to do with the skin because it's constantly growing.
So constantly renewing. Are these things that you could use, and then if you started seeing some changes again, you could use them again?
Exactly. You use them on a regular basis to keep yourself in that healthy look.
All right, perfect. Well, we are going to talk about even getting a little bit more invasive. We're going to talk about Botox coming up after the break. So we still have much more to come. Don't go away. North State Health will be right back.